What does it feel like right now on you?
I could lay down. It feels good. Right now I don't really feel anything except, per se, my fingers feeling a little cool. My body, I feel relaxed, believe it or not.
You note the erythema, the redness? That is, that's the...
Which for me is huge. Just, I have sensitive skin, and in the summertime, sweat and everything bothers me a lot. So by managing my coldness, this all goes away within 5 minutes when I put my clothes back on. And I'll get in my truck, and like I say, I'm on my feet all day. I'll be pain-free. It's very, my quads feel awesome.
Are you tingly at all right now?
My quads are, and my chest is just a tad. I feel room temperature. I do not feel cold.
Yeah. I mean, like you were outside a little bit in the cold weather, but...
Yeah. If anything, even my hands, feel my hands, are they?
No, not too bad.
No.
I know some people that have colder hands than that.
Yeah. Warm heart, though. Yeah, so I just find this to be effective. I'm a go-getter. I don't like to hold back, and as you mentioned, I am young. And right now, what I'm fighting is my health and my ability to do my job, and my job is very physical. So at this point in my life, I got a lot of responsibilities, and I'm willing to do whatever it takes to do what I love, which is radiology, but at the same time, it's very physical and demanding, and up and down, standing, as I'm sure you're aware of, it can catch up to you, especially if you have elements. So Steve's helping me maintain my longevity, if you will. I got a young family, I got a long ways to go, and right now Steve and the community has helped me extend my longevity, at least for now, and reduce oral medication, which I'm not a big fan of. I really feel like the more we can help take care of ourselves and do it the right way is better. So.
I mean, what brought you in here initially?
Initially, I kid you not, I was at a point in my life. I had surgery on my hip December 14th up in San Francisco. I've been struggling with a little bit of my recovery. It was arthroscopically. I was at a point where I'm fed up with laying on the floor and icing and kind of turning and icing more. And my kids, you know, I just got fed up with it. So I was literally on a hunt, Googling ice baths. And I found a few. And then I just so happened to say, okay, with arthritis, you got to walk. So I got up and I walked from my house, which was not far away. And I went to the bank across the street, and from across the street, I said, let me go see what's in my local community area here. And I walked in and I said, cryo, this is like an epiphany. How'd this, I mean, I'm looking for this. And so I knew cryo from Dr. Simonian doing surgery on me. He gave me a cryo cuff, so I knew ice and a few other things. And I called Steve. I was looking at the number on the window, and I called Steve up. I said, hey, is this ice? And he says, not ice. It's a cold treatment, cryo treatment. Come on in. And so I came in, visited, talked, and I signed up for the first session. Why? In healthcare, I just see the benefits of ice in a lot of different areas. I've been told, as I mentioned, I had surgery, and they told me that I have osteoarthritis a little worse than they had anticipated, which didn't surprise me. And so with that comes a little bit harder of a recovery. It takes a little longer. And so I found this to be effective. It's helped not only my hip in terms of just the inflammatory, trying to get it, it's deep tissue stuff, and they break it up in the scar tissue. So I feel like the treatments have helped just for muscle recovery and my own hip recovery, and the added benefits have just helped with my muscle pain. I have been suffering for the last year of a lot of muscle pain, joint pain stuff.
How bad is it for you?
There have been times where it's probably creeped up to about 8 where the muscles are just in pain. Just it's from what I understand, I've been told a lot of different things, and I'll just keep it simple. I know I got arthritis, and they've told me some other stuff, which right now I'm just trying to manage with anti-inflammatories and ice.
And so, okay, and how do you feel now? You did the session, you're out. How do you feel now?
It's euphoric. I feel a lot better. My shoulder's not bothering me. That's what I find every time I come, is my shoulder nags at me all the time. And when I come in, I get really first and foremost of my shoulder. And right now, I know it sounds weird, but I feel good. I can't say that my physical being is always feeling good. I tend to suffer from pain quite a bit. And so I take advantage of these moments. Pain-free moments to me are cherishable moments. And so right now it'll last probably 2-3 days, depending on how physical I get. But right now I feel relieved, I feel chilled, and I feel fresh. I feel like I'm ready to go. I'm on my feet all day long, and so at the end of the day I usually feel the worst. But right now I'm charged, ready to go.
There is a cost for this.
Yes.
And insurances don't pay for these types
I
of things.
wish they would, but you're right, they don't.
What do you think about that cost for you personally? I mean, is it,
You know, I think that I've dealt with pain in my face this last year, and I can say that for me, physically, there's no price to feeling good. Of course, it's the first thing we all think about is, how can I make this fit in my budget? But my mother-in-law told me best. She said, Tony, is there a price to feeling good? And if you feel as good as you are, is it worth it? And for me, it is worth the price. I do suffer from osteoarthritis. I do have muscle pain. A lot of my research in cryotherapy has addressed osteoarthritis and muscle pain, so I find it's something that I'm willing to pay for since insurance doesn't cover it.
and do you have any family that are naysayers that say, yeah, you shouldn't, that doesn't really work? It's mental.
Yes, there's always, I do work in the science industry, and there's always talk of, is it the placebo effect? Is it just mental? I can only go based on the athletic side of me and the icing side of me, and what I know is that if ice wasn't around for the athletes, they probably wouldn't be doing what they're doing as consecutive as they do it as a career. I feel it's beneficial. Technology costs things. Technology, you pay a price. The equipment cost factors are there. For me, I'm willing at this moment in time to continue the treatment because I have found it to be the most effective for me with overriding any medication. Because initially they just wanted to give me pain pills, and I don't want to take pain pills. So I found this to be something where I come in 3 minutes out of my day, and it's very effective for me to move on throughout my day without as much pain, and that's really the benefit.
I mean, what initially brought you in? There's a lot of ideas, a lot of treatments out there. What made you say, I'm going to do this?
Okay, a couple of years ago, I followed Dr. Oz on TV, so I was watching Dr. Oz, and he was doing a special on the cryo chamber, particularly for women with fibromyalgia. Well, I was diagnosed with fibromyalgia about 10 years ago, probably, and so it really piqued my interest. So I've been looking for this treatment for a couple of years, and I found somewhere in the Bay Area, but I couldn't, I couldn't get there. So I was thrilled when I picked up the paper a couple of months ago and I saw Steve's ad for this. So right away I called him, and I got my husband and I to start coming in, since my husband has some age-related arthritis stuff. And so I've had 5 treatments with Steve. This is my 6th treatment. And I feel the benefits, or I wouldn't be coming back. With fibromyalgia, you have a lot of, your whole body is full of inflammation. It's muscular, so my muscles ache. I have a lot of pain, so I'm on medication for the pain that I'd like to get off of. It's not good for me. I don't like to be on it. The inflammation is in the brain also, so I have like chronic fatigue, mild depression, brain fog, a lot of brain fog, and I'm just feeling with these treatments, it's like pulling the inflammation out of my body, and I'm already cutting myself back on lowering my dosages of medications as I continue to use the treatment.
How soon after the treatment do you feel it?
You really feel it instantly. There's a rush, there's a head rush and a buzz as the endorphins get released from the brain. And so I'm kind of happy and glowing, in a great mood, like taking an antidepressant, I guess, or having a great cocktail maybe on the beach in Puerto Vallarta. And it's systemic, so it's really lasting. I mean, you know, what am I trying to say here? It builds. The treatment builds. So I feel better after every treatment, if that makes any sense.
How long will it last?
Well, this initial buzz, oh, I'll be just happy all day long and gabby. But, you know, that sort of decreases, but every treatment I feel better. You know, I go up a notch in my recovery.
What does it feel like when you're actually in there? I mean, does it feel like tiny little, what does it feel like?
It's not painful and it's not uncomfortable. It's just really cold, but it's really bearable. I didn't think I could do it. I'm very susceptible to cold, and I have neuropathy in my feet. My feet are numb and cold and ache all the time. I didn't think I could do the treatment, but it doesn't bother me. So,
how long do you think you'll continue to do something like this?
I kind of think indefinitely. I may be, you know, depending on how I do, I may cut back to once a week, but right now, 2 days a week seem to be just fine for me as well as my husband.
There are skeptics out there who do not believe in these kinds of things. I know the FDA has not, you know, completely, you know, came out with a ruling on this. Does any of that make you nervous, or what do you say? Is the proof in the pudding?
Yeah, the proof is in the pudding, and that it's an individual thing, and it's something that works for me. It helps me, and it doesn't hurt me in any way, and it's better than ingesting a bunch of medications. So if I can treat my problems, you know, naturally with this gets me in shape so that I can get back to yoga, which I haven't been able to do in a few years, and now I am doing gentle yoga again. So the pain thing is a vicious cycle. You get into pain and you get depressed and you want to just lay in bed all day with my chihuahuas and watch TV, and that's kind of that's where I've been. And this treatment has really kind of woke me up and brought me back to life. As far as clearing my brain fog, I'm thinking more clearly, and my depression is gone, and I'm just generally in a better mood and more functional.
Any other, as far as your pain level, where has it gone?
Well, you know, the doctors always ask you, what's your pain today from 1 to 10? And my pain level varies around, you know, 7 to 8, something like that generally. And I would say it just drops. Every time I'm here, it probably drops a notch, a number. So now, like right now, I'm not having any pain anywhere, and that's pretty unusual for me. I have chronic pain everywhere, so right now I have like no pain. So, and then when the pain comes back a bit, I'll be back in to see Steve in a couple of days. So twice a week seems to keep the pain down. Hopefully, maybe eliminate it someday completely.
Anything else you want to say that we did not ask you, Ernie?
I would say that to give this a try, I'm telling my friends my age in their 60s and 70s that are dealing with chronic pain, you know, as a way of managing that pain in a healthier way than medication, to give this a try, because it can't hurt. It can only help. So I'm a good advertisement for Steve.
So with fibromyalgia, I mean, that's been would you say debilitating?
It is pretty. It can be very. You know, it varies between individual, but it can be pretty debilitating, and it's really creeped up on me the last few years. I didn't know how bad I was getting until I just kind of. We have a big house and a big yard, and we have done pet rescue. We have dogs, 20 cats. I don't want to say that on film, but you can erase that. But I kind of, after these treatments, after this 5th treatment, honestly, I walk around my house and my yard and I see where I've been the last few years. The yard's a mess, the house is a bit of a mess. I've become a bit of a hoarder, and it's like you just wake up and like, where have I been? Well, I've been in bed feeling really, you know, bad and not being able to function to my potential. And I'm coming back.
You did a great job, Ernie.
Okay, thanks.